father was a construction worker and a firefighter back in the 70s and started working construction in about 1977. He did grunt work, sanding, sweeping up after drywall work, taping, mudding, cement work, that type of thing. And from what we know, there was asbestos in the joint compound, asbestos in the concrete, we think. The buildings that he went into as a fireman laden with asbestos. I used to wear his jacket to go outside to get the mail to feed the bunnies, this jacket that was encrusted with dust. He would come home, I would hug him, I would go for rides in his car, which was dusty. So we're pretty sure that's where the asbestos exposure came from, was approximately 1977, 1978. I was 8, 9 years old at the time. I was a completely healthy human being. I'd never done hospital time. I'd never been sick with more than a cold or like chicken pox when I was a kid. Completely healthy. My first hospitalization came when I had my baby for a C-section. Up until then, I'd been 100% healthy, nothing ever wrong with me. So no illnesses to speak of up until then. My baby was born in August of 2005. I had only gained 5 pounds throughout the whole pregnancy, which in its own is kind of a curious thing, but I was a bigger gal, so we thought, oh, I'm eating healthier, things are good. I'm not gonna, it's just gonna be a healthy pregnancy. Lily was a breech. I ended up having a C-section. And after the pregnancy, they told me I was a little bit anemic. So to keep an eye on that and maybe eat a little bit more meat and just check my iron. As the months progressed, I kept getting weaker and weaker, more and more tired, more and more pale, and my anemia got worse. I finally went to the doctor when one morning I went down in our basement to get laundry, brought the laundry upstairs, had to stop halfway up to catch my breath. Stopped at the top of the stairs to catch my breath again, sat down on the couch, exhausted. Lily, who was just a baby at the time, was in her swing right next to me. I sat down on the couch and fell asleep. I was utterly exhausted. Woke up 2 hours later to a cooing baby, scared out of my wits because I had just literally passed out for 2 hours, and I knew there was something seriously wrong with me. So that's my first tip-off that I was really sick. Well, I went to my doctor with these symptoms, a fever that wouldn't go away, the tiredness. He thought I had a heart virus that happens to some women after pregnancy. He was reluctant to put me on antibiotics because I was nursing at the time and said, well, take these iron pills, come back and see me a week if you don't feel better. A week later, I went back. I had not been feeling better. He decided to do blood work, did a chest x-ray, and that's when he found a liter of fluid around my left lung. I was then sent to a hospital in St. Paul, Minnesota to have a thoracentesis done, where basically they stick a needle in your back, drain out the fluid. As the doctor was draining out the fluid, he kept saying, which I didn't really care to hear, and asked him what was up. He said, well, the fluid is an odd color. It's not what I expected. We're going to send you in for a CT scan. So after the fluid was drawn and the thoracentesis was over, I went for a CT scan, and that's when they found the tumor in the lower left portion of my lung. So I was diagnosed quite quickly. And it was about 2 weeks later that we got the confirmation, November 21st, 2005, 1:30 in the afternoon. I'll never forget it. I mean, we just had a baby. We were, looking forward to being parents, and supposed to be the happiest times of our lives, right? You're not supposed to get this disease that has a very dire survival rate. And floored, blown away, devastated. Whatever you can think of, he was very angry as well. 6.5 years, I am considered a long-term survivor, which, hey, that rocks in my book. So, and as far as I know, I am cancer-free. I had an extrapleural pneumonectomy. My doctor in St. Paul knew that he was not capable of handling what I had and referred me to Dr. David Sugarbaker out in Boston, who is one of the world's leading specialists in the disease. I was lucky enough to be considered for the surgery called an extrapleural pneumonectomy, which is the removal of the entire left lung. So I was a candidate, I was healthy enough, I was young, I was strong, I was able to stand the surgery and actually live a life afterwards. So I went under the knife on February 2nd, 2006 and had my left lung taken out. And here I am. I met Linda at the Mesothelioma Applied Research Foundation, MARF, conference 2 years ago. She heard a little bit of my story, grabbed my arm and said, "I need you." As Linda does with most people that she meets. And so I said, okay. And it just became a series of emails. And next thing I know, she asked me to speak last year at the conference. And I jumped on board and said I would love to. So she kind of started my whole activism and got me started in getting my story out there, letting people know that there is hope. You don't have to lose all hope when you get a mesothelioma diagnosis. There's treatments, there's help, there's people who are surviving and are surviving long term. I would like to say, yeah, I was lucky enough that my tumor was localized, that it had not spread. So that could be part of it. Radical treatment, incredible medical care, quick medical care. I was not misdiagnosed for 6 to 8 months beforehand. I was diagnosed and the tumor was gone within 2 months. And that's a big, big part of it, is what I think. That attitude. I do get tired, I get worn out. Like walking up a lot of stairs, I get winded. I am more prone to getting tired quicker. My oxygen level sometimes dips a little bit. But for the most part, I feel quite good. I'm active. I volunteer with my daughter. I do gardening in the summer. I don't shovel or ski or anything like that in the winter, but I try not to let it get me down. I do what I try to do and do the best that I can. I've never run a marathon, so that was never going to be anything I would ever do. So the fastest growing number of newly diagnosed patients are young women. Probably as a result from household exposure from their dads working with it. Prevention is key, awareness is key. I think that getting the word out. Mesothelioma is more than a commercial on daytime TV. It affects real people, it affects young people. It does not just affect men who worked with it in the shipyards. Although yes, that's horrible and tragic and very much a part of this disease. I am now the face of what mesothelioma is. This is who's getting diagnosed with it, this is who's fighting it. And it's through the household exposure. And so banning asbestos is going to be a huge start, but awareness is key, and that's where it needs to start. Becoming aware of what asbestos is, what it does, where it's at, and how it affects people. And that's my goal, is to bring about more awareness for the disease and for the dangers of asbestos, because so many people think it's banned. And so many people think that it's just a thing that lawyers talk about, and it's not. Cancer is truly a double-edged sword. On one hand, it's the worst thing that's ever happened to me. I never in a million years thought I would ever deal with cancer. On the other hand, I would not be here. I wouldn't have met these amazing people, these amazing warriors, had I not had cancer. My family stands behind me 100%. My husband is here at this conference with me, supporting me. He's involved with it as well. And it just really is important for us to fight back and make people aware. My dad wants to support it. He's in complete support of it. And he's angry. And by helping us out and supporting us in this, helps kind of soothe his anger a little bit. So it's been really, really good for us in a weird, sort of serendipitous way.